Now, I just want to go back. You said earlier it's a genetic disease. It's an inherited disease. So can you just talk a little bit more about that? For example, inherited from your parents, and if your parents have it, what are the chances that you may inherit the disease?
Every individual that has it has a 50% chance of passing that on to each of their children. So each time it's like flipping a coin, and it doesn't matter how many brothers or sisters you've had that don't have it, every single time afterwards it's the same odds, 50-50 odds. We sometimes hear about conditions skipping generations and things like that. That's something you might see in that recessive form where they can be scattered throughout, but in this dominant form that's not the case. It's 50-50 and you either have it or you don't. If you inherit it from your parents, then you have a 50-50 chance of passing it on. If you don't inherit it, even though your parents were infected, then that's where it stops in that branch of the family tree. You don't have to worry about passing it on to your children. I might just take a step back for one more thing to mention is that although we say we talk about inheriting it from your parents and 50-50 chance and things like that, about actually a quarter of the people that we meet with polycystic disease have no family background of it whatsoever. So like all genetic diseases, somebody has to be the first one who's affected. And so we do see a lot of those individuals, even though there's never been anyone before, unfortunately they were the first one. Somebody has to start the chain. That's right, yes. Somebody has to start the chain. And some of it also may have been underdiagnosis in the past, that as people are living longer and longer, it may have been that people in the previous generation passed away before anything was known about it. But now as people are routinely living into their 70s and 80s, again, I think we're seeing more of that disease that probably flew under the radar before. So it is quite common for me to meet somebody who has no known family background, and yet they do have polycystic disease.
That makes sense though. So in terms of diagnosis, how do you diagnose the disease?
Yeah, so our main ways of doing this is with things like imaging tests like an ultrasound or sonogram that, like people have when they're pregnant, that type of test. Because just based on the appearance, we can often make that diagnosis, especially when we have a family history to put together with that. A simple test like an ultrasound is actually very, very, very good to make the diagnosis.
Right now, there's no cure for polycystic kidney disease, but there's certainly, I think, hope for patients. There's new medications that are coming onto the market that are looking at slowing down the progression of the disease. Can you talk a little bit about that piece?
Yeah, absolutely. With polycystic disease, I think this is a very, very hopeful time in the disease. There's a lot of research being done and a lot of developments being made about how to manage this disease. Even compared to 10 years ago, we've learned, many, many things that we had no idea existed before. And part of this is treatment. We've just in Canada a couple of years ago, the first very specific treatment for polycystic disease was approved. And that's, it's a very exciting thing to see. We often see new drugs come through in medicine, but it's rare that you see the very first treatment for a disease that has gone from having no treatments to having one treatment. That's a big, big step, especially for the people and the families who have been living with this disease, for many, many years. This one treatment, it's not a perfect treatment, it's not a cure. It's something that slows down the disease progression, and it really is only applicable to a certain subset of people with polycystic disease. But again, just having that treatment out there is a great first step. And what I can tell you, being kind of having my finger on the pulse in the research in this area, is that there's many more things coming down the pipeline. And I think that before long, you'll see that we've gone from a disease with no treatments to one where we have many treatments. And when we get to that point, that's when I think we'll really start kind of changing the face of PKD and what people experience with it.
And well, that's certainly a hopeful message to end on for PKD patients. Thank you very much, Dr. Bevilacqua.
Oh, my pleasure. Thanks for having me, Deborah.